I'm Kurt Locks, Dean of the Brooks College of Health at UNF, and I would like to welcome you to the 5th Annual Jacksonville Bold Goals Summit. 3 years ago, within months of my arrival to UNF in Jacksonville, an Osprey alum named Paul Sapia reached out to me and asked me to serve on a panel at an event for something called Bold Goal, a Humana community health and wellness initiative. This was a wonderful opportunity for me on many levels, but what I came to realize was that it was a truly wonderful opportunity for the entire Jacksonville community. I look forward to these Bold Goal events each year, and I'm honored to moderate the 2 panels this morning. However, as we all know, the critical activities are those taking place in our community. And I want to take a moment to thank Paul Sapia, Laura Nolan, John Montgomery, and their colleagues at Humana for sponsoring a number of initiatives targeting the health of our community over the past several years. I would also like to thank Justin Beagle for making this all happen virtually. This year, Humana is taking the annual Bold Goal Summit to another level, despite, or perhaps due to, the ongoing pandemic. To be specific, Paul and his colleagues have planned a series of virtual summits, beginning with this one here today. To that end, we have enlisted the help of 6 outstanding professionals to discuss the topic of reopening during COVID-19. In a moment, Paul Sapia will introduce you to our panelists and set the stage for today's summit. Before I forget, please note the Q&A button near the bottom of the screen and use that to submit questions at any time that you would like the panel to address. My last duty in this welcome is to share the following short video with you. So, Mr. Beagle, if you would, please. Thank you, everybody.
Thank you, everybody, for joining us. Thank you, Kurt, and thank you, Justin, for setting this up for us. And thank you all for joining. You know, I'm a bit sad that we're not in the same room like we are every year. We really do miss the interactions that we have, the conversations that come from in-person meetings and the connections that we make. And despite not being able to physically meet, we have an opportunity to bring you some value in this bold goal through our virtual summits. This pandemic has really forced us all to be creative and think differently about how we can stay connected to our families, friends, and business associates. As we've looked to maintain our Bold Goal Collaborative and the impact of the health of our community, we have to evolve and develop new partnerships and thought processes in order to make a difference in our area. Over the past 6 months or so, we've worked closely with the First Coast Relief Fund, Elder Source, United Way, our medical provider groups, and others to identify people in our community that are struggling to meet their basic needs. By working together, we're able to support community partners in providing those needs, like home-delivered meals, cleaning supplies, and household goods, as well as virtual exercise and wellness classes. We also work together to identify and support the community organizations that are continuing to do such amazing work in our area. So I don't want to spend a lot of time going through the background of our bold goal, but I want to talk to you how we started and how these lessons have evolved and how we've evolved. So as you remember, we had a bold goal of improving the health of our community 20% by the year 2020. And as we reached 2020, we realized the work should not and could not end. So we set new goals, integrated deeper within the Humana business efforts, and cultivated new community and national partnerships to continue improving the healthy days of our members and the First Coast. So, as we know, a person's health is greatly impacted by the socioeconomic and community factors as well as their lifestyle choices. Now, as we're still experiencing shutdowns and limitations due to the pandemic, these factors are more noticeable and the work becomes even more important. So Dr. Montgomery asked me to say this, and I think this is really impactful. We started the Bold Goal, Humana started the Bold Goal in 2015 in San Antonio, and quickly grew to 7 markets. Jacksonville was the 8th Bold Goal market, started in 2016. As we come to the end of 2020, we're now in 16 cities. You can see them listed here on this map. And we've developed a Humana military population health effort working with active duty military members and their families right here in Jacksonville and in San Antonio. And we've integrated more deeply with our work in the Medicaid and commercial business segments. We have an academic partnership team that is working with a variety of institutions across the country, including one we're going to announce here at UNF. And we're continuing to build and integrate our Bold Goal. And I want to thank all of you for being a part of it. So over the next 80 minutes or so, you're going to have an opportunity to hear from some amazing panelists with both national and local perspectives on how COVID-19 has affected our businesses, our schools, communities, and the lessons we've learned as we've reopened. So there's going to be an open Q&A session. Kurt mentioned it earlier after each panel. So feel free to utilize the Q&A feature on the Zoom webinar. If we don't get to your question, we're going to do our best to answer it and send it out with our follow-up emails. So with that being said, I'd like to bring out our panelists. And so first is Dr. Nick Van ter Weyden. He's the Managing Director and Strategist for Incremental Healthcare. Dr. Nick brings a distinctive blend of experience as a medical practitioner and business strategist, both here in the U.S. and internationally, to the realm of digital healthcare technology. He's a graduate of the Royal Free Hospital School of Medicine at the University of London. He's a pioneering creator in the evolution of healthcare technology. And after several years working as a medical practitioner in London and Australia, he joined an international who's who in healthcare, academia, and business in the development of the first electronic health record in the early 90s, and later as a business leader in one of the first speech recognition companies. His combination of patience, creativity, skill, and intrinsic business ethics has led him to a diverse career in healthcare with some of the most prestigious hospitals, consulting firms, and technology companies. Dr. Nick focuses on small incremental improvements that we can bring from other industries and how they can be applied to healthcare to bring immediate value and also lead up to the big changes that can create meaningful evolution in healthcare. So secondly is Fred Goldstein, the president and founder of Accountable Healthcare LLC. Now, many of you recognize Fred from our meetings here. He's been an integral part of what we're doing and a big resource for me. So Fred is an instructor at the John B. Bauer School of Population Health at the University of Mississippi and the founder and president of Accountable Health LLC, a healthcare consulting firm. He's got over 30 years of experience in population health, disease management, HMO, and hospital operations. Fred founded a disease management company that provided services to employer groups and 10 state Medicaid programs. He operated a Medicaid commercial HMO that was ranked highest quality Medicaid health plan in Florida and developed an award-winning mobile health app. He's worked with employers, health systems, and vendors to develop population health programs and services. And he was directly responsible for the inclusion of the Medicare annual wellness visit in the Affordable Care Act. He serves on the editorial board of the Journal of Population Health Management, founding advisory board of the Population Health News, and is past chair of the board of the Population Health Alliance. Fred has testified before the legislature in Alaska, Florida, Kentucky, and Texas on disease and population health management, and he's also the co-founder and lead host of Pop Health Week, a weekly podcast. And if you're not listening to it, please start downloading it. It is amazing. You get some amazing guests, including Dr. Nick. And finally, Dr. Jerry Parrish. He's the chief economist and director of research for the Florida Chamber Foundation. In that role, he's responsible for conducting in-depth analysis on Florida's economy and solutions to help Florida's future. Dr. Parrish previously was the chief economist and director of the Center of Competitive Florida at Florida Tax Watch. Prior to that position, he serves as the associate director of the Center of Economic Forecasting and Analysis at Florida State University and has many years' experience in private sector and management roles for international manufacturing companies. Dr. Parrish is currently an adjunct instructor in the Master's in Applied Economics program at Florida State University. So with that, I'd love to welcome our panelists and also bring back Kurt Laux, who's the Dean of the Brooks College of Health at UNF, who met previously. And so thank you, Kurt. I appreciate your time.
My pleasure. Thanks, Paul. Well, we do have a lot to do and probably not enough time to do it. So I'm not going to waste anybody's time. We're going to go ahead and jump right into it. We have a few pre-selected questions. And then, of course, as Paul indicated, we'll have time for the audience to ask questions via the Q&A button after we're done. So again, thanks to all three of you for being here. Let me go ahead and start off and toss the first question out to Mr. Goldstein. And that question is, what are some of the trends you're seeing that you feel are having the greatest impact on our ability to reopen successfully and or return to normal activities? Fred?
Thanks so much, Kurt, and thanks to Humana for putting this on. Really enjoy all the work they've done with the bold goal. If you think about reopening, I'm going to talk from two different perspectives. One is an employer perspective, we work with some of them, and then the other is a university perspective, which are slightly different depending on how you approach them. But the biggest issues we faced are getting people, as we've understood more and more about the virus, how it spreads, et cetera, is getting individuals to appropriately follow through and do what are the recommendations that can most mitigate risk in all the different areas. And there's not one single approach that's going to do it. It's a layered system of wear a mask, socially distance, wash your hands. And if you think about it from a university perspective, those that have been most successful at reopening have, one, pre-tested their students before they showed up. The reason for that is really to shrink the funnel and identify those that are positive so they don't come back, and you've automatically reduced the possibility of some infection there. And then a really strong program to identify and contact trace folks ongoing. And those that struggled outran their resources to do that and essentially decided we can't reopen or we're going to close our school. But those that have done those things have functioned appropriately. I think from a business perspective, it's really about determining and understanding that indoor risk factor and saying, if you're coming indoors, here's what the requirements are going to be. Wear a mask, socially distance, and also look at all of the other things that go along with that, such as airflow, cleaning, et cetera, to try and make it easier to reopen. We can reopen businesses and things, we just have to do them smartly. And in some cases, we've been less than good at that.
Thank you, Fred. That was wonderful. Dr. Vanderheyden, if you might weigh in on this as well, please.
Yeah, no, absolutely. I think Fred's entirely right. This is a total approach. So there is no one single answer. I think we see that from other countries in particular, where there is a varied approach with more testing, less testing, more isolation, less isolation. It really is a spectrum that applies the best available information. And you know what I'm often heard to say is that the best available option is always available. The perfect option typically is not, and we have to select that best available option that minimizes the risk as much as possible, given the context of the local geography, the individual circumstances, and indeed economics.
Excellent. Thank you for that. And Dr. Parrish.
Yes, you know, one of the things we're doing here, we started at the Florida Chamber, was, you know, just information, getting information to our local businesses out there. You know, we did it through our network. We've got a bunch of local chambers all around the state. And one of the things we did here was we got masks and we delivered them to businesses, and we got information and we shared best practices between businesses. You know, I remember when this thing first started, you know, people were, even before it was mandatory, they were, you know, opening up one way into the business and one way out and limiting the number of people and all those things that later become kind of standard. One-way aisles we're going for a while. But that's been our part here at the Chamber Foundation. But we're also looking, you know, how do we get these people back to work? You know, at one point we had more than 1 million people looking for jobs here in the state of Florida. We're down only to 753,000. So we're trying to help those folks share the best practices so we can save as many of these small businesses as we can and get as many people back to work as we can.
Thank you, sir. Fred or Nick, any follow-up to what Jerry just mentioned?
Yeah, I would say, you know, my glass is always full. It's half full of whiskey and half full of air. And I see this in the perspective of we have good examples of this being successfully done in other places, certainly around the country and around the world. And that gives me great cause for hope. It requires a coordination. It requires some expertise to tease out you know, what is essentially a moving target most of the time, but it is possible. And I think that's the message that I would want people to take away, that, you know, it can feel a little hopeless at this point. We're 7, 8, however many months into this, and you feel like we're going through this recurring theme. It is possible, but it requires focused and continued attention. That's the key here, is don't let up. Don't think, oh, okay, you know, the cases have declined, we can now sort of let up and stop doing all of the things that we did. It's a graduated approach that is informed by science and expertise.
Great, thank you. Fred, anything else to add?
I would just say that it's easy to say, here are the guidelines. Sometimes they're a little bit vague, but it's really about understanding your unique situation. We see each place reopen with slightly different approaches based on their location, their culture, their facilities, their resources, and all of that really needs to be taken into account to safely reopen, or to reopen safer. It's a matter of reducing risk. We're not taking the risk to zero. And so I think it's important to recognize that there are thousands, literally as we work through with some of these universities, thousands of questions that had to be gone through and worked out in order to come up with a strategy that so far is working for those that it's doing well with.
Yeah, I appreciate that. Thank you, as a person who was involved very much in that process. And Jerry, any final words before we move on to the next question? I want to give you the last word.
No, I will tell you my Zoom dropped out. I apologize. I had a little internet issue. So let's go on to the next question.
All right. I appreciate that. Then Jerry, we'll go ahead and let me ask you to start us off with this next question. What is the biggest mistake we have made with respect to reopening?
That's a great question. You know, you got to expect mistakes. So if I call something out, you know, it's not an indictment here, because this is such an unusual thing. You know, one of the things we've been showing in some of our presentations down here is pictures from the Spanish flu times, when people were watching football games with masks on in 1918 or whenever it was. People still wanted to go to football games, and so you know, but we're so unused to this, and we were so unprepared for this. I think that's probably in general the biggest mistake. You know, we weren't prepared. We didn't have domestic suppliers for a lot of these things. You know, even when we call this thing over, it's actually an opportunity for Florida to, you know, because, you know, businesses are going to, you know, demand local suppliers for a lot of these things. I look at that as an opportunity here for the state of Florida. But, you know, hey, you can't control some folks. You know, when you happen to open up the schools and you have a bunch of college kids getting together that haven't been anywhere for 6 months, you know what's going to happen. We knew it would happen here in Tallahassee. You know, you have to expect that kind of things. But all in all, I really believe most Floridians have been really responsible. I've been proud of them, because we are on the way back to recovering a lot of those jobs that we've lost. And we'll end up back with the tourists and things later on to help the economy. But mistakes will be made. I don't think we made an unusual, you know, high share of them here in Florida, though.
Great, thank you. Fred?
Yeah, as I look at the situation and say what's worked well and what hasn't, the key really is for us to get to the point where as we communicate to individuals, they understand what that means with the latest communication, and also understand why it changes. And I think we've fallen short on that. As we learn more about the virus, things change. We have to do things differently. And getting that message out and getting people to understand the importance of that message has been critical. And I think we can do a little bit better job about it, all of us. Obviously, the chamber's pushing information out, and others are pushing information out. Sometimes we're pushing information out against forces pushing information the other way. And it's really about trying to get the best information out that we know, but helping people to understand, here are the behaviors that you can do that will help minimize your risk and the risk to others.
Okay. And so Fred, any one particular mistake that you've seen, particularly as you focus nationally over and over or read about, that seems to have been a commonplace that going forward we might say, yeah, that might not be the best approach?
I think with the schools coming back, in particular the colleges, not pre-testing students was a mistake. And obviously, early on, that was not a CDC recommendation. It wasn't even a recommendation as we discussed that with some of our clients. So I think it's understanding that it's about minimizing risk, and anything you can do to minimize risk, you should be trying to do.
Great, thank you. Nick.
Well, so I wanted to just build a little bit on Jerry's point there, that this is actually a picture from the 1918 pandemic, and they were doing the same thing. I think, that's an extraordinarily important point. This is, not entirely new to us, and managing through that process is extraordinarily informed by all of the content. And in fact, much of what we learned in that still applies today. And I know that's a little bit shocking given that, we're 100 years plus with much more in the way of science and information. I'm going to give you one, the highlight or the top mistake from my perspective for any of the groups that I've worked with. And that is the failure to recognize that you are going to make mistakes and you have to be agile and quick in responding. So an acceptance that we are imperfect in terms of our decision making, in large part because we're chasing information in real time and we have to adapt. And the idea that you're going to hit this out of the park in the beginning, I think was the potentially the biggest mistake. I'm not saying all sorts of people made that, but that for me is the most relevant lesson throughout this. And it's still true today. So there is no, we've got this, we continue. We're continuing to learn and build this particular plane as we fly it.
Excellent. Fred and Jerry, any follow-up?
If there is one thing that we learned early, is we were reporting, we have a thing called the Florida Scorecard. You can find it at thefloridascorecard.org. And for the state level and all the county levels, when we started reporting numbers, it was just the number of cases. And so I tried to, tell people that, well, the number of cases, nobody's following these people around and taking them off the list once they get well. That really, that things like the average daily cases and, hospitalizations, our hospitals running out of capacity, which fortunately we're down to, probably around 20% of number of COVID cases in Florida and in hospitals now compared to where we were at the peak. So it was really an effort of recognizing that, hey, we started off saying the thing that everybody, all the news people wanted to hear, but really wasn't the most important thing. And so now all our reporting that comes out on social media and those kind of things use those other metrics rather than just raw number of cases.
Yeah, great, thanks. Yes, and I was reading an article earlier, the Chronicle of Higher Ed, that did talk quite a bit about these dashboards and the value of them, and so that maybe if we have time, we can get into that as we go forward. I do, before we move on to the next question, want to remind the audience that please submit your questions via the Q&A button at the bottom, and we'll take as many of those as we can when the panel has answered a few more questions. And with that, I will skip to now the third question. And Nick, I'll ask you to kick us off with this. A little bit of a long question, so hang in there with me. In the face of so much conflicting information regarding controlling outbreaks and keeping people healthy, how can we sort through the data to make the best decisions in terms of reopening? And as a second part of that, where is the science most solid and where is it most unsettled or conflicting?
So I have to be honest and say that the process of teasing out appropriate information demands that you have a solid backing and you follow, for the most part, the consensus of scientific perspective. Now, that's not to disregard new opinions, new concepts, or new ideas. And the big challenge I have in advising people, where to go is that even going to good sources, so if you define the CDC, WHO, the Lancet, and so forth, even in those instances, you have to dig at least one level deeper to ascertain what the source information is. I mean, we've seen a number of instances where there was a rush to publish information or put information out that has essentially come back to say, oh, that wasn't so good or smart from an advisory perspective. And the challenge for most individuals is to be able to interpret this with an epidemiologist hat, a medical hat, a population health hat. And that's where I think you bring the team-based approach and, importantly, external advice. What's interesting to me in all of the exchanges I have with folks that we're working with is the welcoming aspect of having this external advice with people that I have to look at and go, wow, they are so experienced and smart and intelligent in this, yet they seek external counsel because you just can't think of everything. And having that combined approach is, for me, critical in teasing this out. So it's not one source, it's going deeper, and it's having a breadth of opinions and contributions to resolving conflicting information that will continue to occur.
Thank you. I will, Jerry, I'm going to ask you to answer next, but I'll read the question again because it's long. So, in the face of so much conflicting information regarding controlling outbreaks and keeping people healthy, how can we sort through the data to make the best decisions in terms of reopening? And also, where is the science most solid and where is it most unsettled or conflicting? Jerry, please.
All right, great question. Let's talk about the, and I'm not a medical person. I am an economist, so I look at things a little different. What is unsettling to me is, we actually don't know how many people have had this disease and how many people, if you're able to get it again. I see the news stories that everybody else does, but given the fact that we didn't have that many tests originally, I understand this, but really what I look at is I would like to have randomized, testing out there just to really see what the population is. And, we all want to know, are these quick tests reliable? And, what's the real reliability of these things? That's the unsettling part to me because we can't give people definitive answers. I had the opportunity to go get tested when, I'm a FSU faculty member. I could have gone down when they started testing people when all the students were coming back to school. But I didn't because I didn't want something, I didn't want one of those swabs in me, and I was busy that day. So I would still like to know about my own personal self. I understand that there's a lot higher number of population compared to the positive tests, and that's all we know. That's the only data we get is the positive tests. So I'll let the medical folks weigh in more on that. They know they have a lot more expertise than I do.
Okay, then with that as a transition, Nick, please.
Yeah, no, absolutely. I think that this whole testing, and you're absolutely right from a understanding of the disease, we need to do more testing. We need to understand the results of those tests, and specifically the antibody test, I think, is a good research opportunity. But at this point, we don't know if levels mean X or Y and how much of those levels. But establishing that baseline and going through a proactive approach is absolutely essential. And indeed, within those do I have it tests, which is, the molecular PCR tests as well as the antigen tests, there's some difference in terms of the profiles and how those apply. The thing I would say relative to this is good news. And again, I try and find the good news, the silver lining. We are approaching an antigen test and a low-cost antigen test that we would see at the point of care or without the need to go to a laboratory that would allow for this to be done as a sort of immediate activity. Now, that still doesn't answer the question perfectly because there's an uptick in terms of when that will turn positive for different individuals. But imagine doing that on a frequent basis. We now start to answer those questions that Jerry rightly poses and says, what is the prevalence of this? What is the total in the population? So I think we're rapidly honing in on this. The Abbott Benax is certainly one of the earlier ones. There's some others that are out there. I think we're going to see an expansion of this, appropriately so, and it's going to need to be worldwide.
Great. Fred.
So, you know, one thing you were talking about, how do you keep up with all this information? I think that's a critical issue because it's a huge amount. And as Nick, I'll steal some thunder from Nick here, who says it all the time. I think it's something to the effect, I've spent more time studying this in the last 6 months than I did in medical school, studying all my stuff, because it's changing so rapidly and so fast. And what that calls for is a couple things. One, as Nick pointed out, obviously a team approach, but each company should take one person. We call it a COVID coordinator. You can call it whatever you want. If you're a large organization, have some committees, bring in some expertise, but have somebody responsible for that, and recognize that you're not going to understand all of the issues with air handling and filtering, with cleaning supplies in list N, with how the virus changes, which masks work, all of those things. So bringing in some resources can certainly help employers as they look to reopen, as well as other organizations and companies around the country.
Thank you. Any last words from the panel on this? Nick or Jerry, any follow-up?
Not for me.
Okay. I think what we'll do, thank you very much. I wanted to try and see if we could get to the audience's questions, and thank you. We now have at least 3 that I can see. So if the panel is all right, I think I've got a 4th pre-selected question, but I'm just going to skip that and go right to the audience. How's that sound? Great. All right. Well, let's do that then. The first question is there a sense of what will be needed in terms of cases, et cetera, where we don't need the extra precautions, or are we having to wait until a vaccine? Fred, if you don't mind, I'm going to turn it to you and let you tackle that first.
Yeah, and I'll quickly touch on it and let that one really go to Nick.
Yeah.
But I think as you think about this thing, the virus is out there. It's indiscriminate, although we notice that it impacts lower socioeconomic groups, et cetera, much more frequently and much rougher, and have to recognize that and begin to figure out how to address that. At the same time, it doesn't matter who it infects. And so until we get to the point with a vaccine, it really is important to continue the safe behaviors that people have talked about. Wear a mask, social distance, wash your hands, you know, and if possible, really watch enclosed indoor spaces. That's clearly coming out as a major issue in terms of transmission.
Thank you. With that, I will kick it over to Nick. Nick, if you would please.
Yeah, no, absolutely. And I think one of the things, as an example of where we've seen a change that might sort of lend itself directly to this, is with surface contacts. I'm pretty sure that most of the attendees on this will probably recall when this first started occurring, they were wiping down the surfaces of any package that was delivered, the delivery of food, anything coming from the supermarket. We were doing all of this cleansing. And that's not to say, you know, to Fred's point, continue the 3 specifics here, which is, you know, personal hygiene, wearing a face covering, and physical distancing. But it does inform us and say, and I'll tell you, I don't wipe anything down when I come back from the supermarket. I'm not concerned or as concerned. That's not to say it's not possible. It is, but it's much less likely. And Fred rightly highlights the interior or indoor element and the air handling. And we've done ourselves a disservice, unfortunately, with building management that essentially keeps the air in and allows no external air. External air proves to be a pretty effective anti-COVID agent, and we've sort of purged it from many of our buildings. So we're gonna have to rethink that a little bit. Good news, again, I try and find the good news here. So I get the sense in that question that, am I gonna have to live with all this stuff forever until we get a vaccine and it's widely distributed? I think there's going to be a variation. We'll see a gradation depending on risk. So there'll be some adaptation. It's not, I'm wearing a mask all the time in all circumstances. I think we're going to see some variation based on the science and the more that we understand about it.
Great. Jerry.
I really don't have anything to add. You know, I think as far as the economy, though, you know, it is going to take a vaccine for those international tourists, especially to come in and feel comfortable traveling. So, you know, it is, you know, leisure and hospitality is going to be the last industry back to 100%, but other industries are coming back quickly. In some cases, construction and others. But yeah, a vaccine certainly would make that confidence for people to get out and do things again. I think that's what it's going to take.
I would add one more interim step, and Nick touched upon this earlier. The antigen test, the cheap antigen test that can be done daily. Perhaps you do it before you go into a restaurant, before you go into a movie theater, each day before you go to work. And no, it's not perfect, but it will allow us to begin to further reduce risks and reopen other things safer.
Great, thank you for that. And I did read into the question, and I get asked this question a lot as well, as can you define for us exactly when things will be so bad that we'll have to shut down? And, and so I think everyone's always looking for some very specific definition of if this, then that. And of course, it isn't that easy. And I know people get sick of hearing me say that, but it's not quite that much of a cookbook sort of approach. Now, having said that, moving into the next question, this may help us get to things a little bit. I would be interested in hearing the panel's thoughts on Florida reopening to phase 3 and whether you believe it was too soon or whether it was appropriate. And let's go ahead and let Jerry start with that one.
All right, great. Give me the politically charged question. I appreciate that. Yeah, I think there's enough information out there to where now people can make their own decisions. So I have no qualms about the reopening to phase 3, my own self. People know that they should wear their masks. They know, that enclosed spaces and indoor, events are the place they're most likely to get it. And, we have to weigh the positives and negatives. And, we've got, quite a few small businesses. We're going to be announcing the results of some research. The small businesses are under stress. They need people back out. So you always have to weigh that plus and minus, but I believe there's plenty of information out there for people to make their own decisions. So I've got no qualms with the reopening myself.
Thank you, Jerry. Nick?
I'm going to tread lightly on this. And also, I do like to be charitable with it because I think it's easy to second guess people. What do they call it? The armchair quarterback activity. We don't always have all of the information. I do think that caution is still advised, but Jerry makes extremely important points. We're all balancing, and this is a spectrum. There is no single answer, and adjusting appropriately, giving people the flexibility, assuming that they make the right decision. So that means continuing to follow the guidance in terms of, distancing, face coverings, and so forth. Okay,
great. Fred, anything else you want to add to this?
Yeah, I was originally going to pass this to Nick since he doesn't have to live in this state. And, but I think, realistically, what concerns me the most, and it sort of touched on my both, we need to reopen. We need to reopen safely, or as safe as possible. That means there are certain activities we probably shouldn't do. And I get concerned when the approach is a carrot-only approach. And I think we need a carrot and a stick, because as we clearly saw with some of the situations in South Florida, there were a lot of people congregating in some of those places. And that doesn't mean, do they know it's not appropriate, or do they know they should be wearing a mask and social distancing? Sure. People know smoking is bad and they still do it. And so we have to recognize we can only go so far with the communications. And in some cases, we may need to look beyond just, hey, this is what we would like you to do, as we do with other things in society that create risks, particularly those that create risks for others.
Thank you. Appreciate that. Now let's go ahead and move on to another question. Nick, I'm going to ask you this one. There's been articles about test results that may have not been reliable. Can you talk about the impact that might have on protocol management?
Yeah, so I think this is essential to understand. It varies by test. And, first of all, there are several elements contained within here. So there's both the reliability, so how well does the test perform on a recurrent basis, but there's also the sensitivity and specificity of that test and its performance. And there's another dimension to this that's about the timing of the test. So when we talk about antigen tests, we think that they essentially have a positive indicator slightly earlier than the PCR, although it's very close. Then there's a long tail with the PCR. The antigen test doesn't seem to have the long tail. How you apply and interpret that absolutely influences protocol. There is no one single answer. And I think what we're going to learn over time is that the combination potentially of different tests with different performance characteristics might improve our ability to be able to detect accurately and make better decisions, to the point that my colleagues have made, which is to reduce risk, overall risk, as much as possible. That's the ultimate goal of all of this.
Thank you. Jerry or Fred, either one want to take a crack at this one? If not, we've got some other questions.
I'll leave that one to the medical folks.
I thought you might. All right. Next one. As vaccines begin to roll out, will we see countries begin to implement some kind of vaccine certification to confer privileges to those receiving vaccines? Certainly the retail industries, like restaurants, are desperate to bring customers back. What are the political consequences of granting privileges to the vaccinated? Oh man, I don't know if we have enough time for this one. Who wants to tackle this?
You know what? I'm happy to go off and talk about this. I understand the challenge of that very point. So, you know, if you start to limit or inhibit people based on vaccination, we have a huge anti-vaccine movement. And, you know, with some of the challenges of the communication of vaccine safety and the protocols being used, this is a very difficult area, not to suggest it's not. And we maybe have to have some level of alternatives, you know, and people can probably quickly get that I'm not originally from these shores, so I didn't grow up with the, you know, the Bill of Rights and individual freedoms, which I eternally respect. I'm very grateful for those. But at the same time, when we talk about certain things in this country, that the analogy that I always use is you don't get to drive at 140 miles an hour on the highway. There's a speed limit, and we recognize that that speed limit is for the benefit of everybody, and we maybe have to have some of those limits applied. Now, I'm not trying to suggest that we, you know, create a separate category of people who maybe don't even have access to it. So there's, you know, a whole host of questions that this raises. But ultimately, what we want is a society that returns to some semblance of whatever normal in the future is. And a piece of that is going to be a successful and effective and safe vaccine. And how we distribute that and demand or require that is going to be a challenge. I'm not going to deny that, but I think it's going to be part of the solution.
Thank you. That was a tough question to take on. Fred or Jerry, anything you wanted to add to that? Yeah, no, nope. All right, and I really thank you, Nick, for taking that one on especially. One last question, and I will toss this to Fred. I think that it is a broad brush that, quote, people know they should wear their masks. When the governor and president are dissidents of public health, your average person isn't always clear. We should err on the side of caution in a pandemic. If not now, when? And Fred, please.
Yeah, so I think that raises an interesting point, and one we've been dealing with. Getting back to communications and getting people to understand this issue, I will say that Nick and I were on a call last week with Dr. Burks, who was visiting Baylor. It's actually public. They put out a press conference on it. And the first thing that she mentioned in the meeting we were in was, I spent the last evening and morning in Waco, walking around your community, and people need to wear masks. More of your community needs to wear masks. You've got an issue that we hope you as a university and you as a community can address. So I think it's important that we understand, obviously it's a political issue now, and I could delve deep into that and probably want to save the rest of my career. But I think it's important that we understand that there are things that work. We can reopen. We can get places reopened. We can get business back. But to do that, we have to do some other things. And if we do those, I think we'll do very well, and slowly over time we'll advance against this virus, and we'll reach a point where we're going to be pretty well functioning, hopefully, as these vaccines come out and they make a difference, we hope. But it's really about recognizing that, yes, sometimes it is better to err on the side of caution. You can go too far in either direction. We need to find that happy medium where we create enough safety to reopen and allow these businesses to go forward, and recognize also that some businesses may not be able to do that. And that's something we'll have to figure out. How do we help those people?
Can I just add one additional point that I think is important here, and I'm not going to, it's 1918 pandemic, same problem was occurring. There was the same anti-mask sentiment. This is not new, something that we will continue to have to deal with. I think Fred's entirely right. And, you know, demonstrating and leadership is a key part of that, but it's a very fine line in terms of personal freedoms. I respect and honor that, but at the same time, what do you ultimately want? Well, I know what I want. I want to be back in some kind of normal living where I don't have to wear a mask. And I think that's involves wearing one for now.
Thank you, Nick. Jerry, anything to add?
No, I think they've done a great job answering that question.
Okay, I agree. Well, so, and now I need to take the time to thank the three of you. I really appreciate you. Those questions were coming rapid fire, and you did a truly outstanding job. And so please stick around in case we have some questions at the end for you again, but thank you for taking the time to be here. With that, I'll kick it to Paul.
Great. Thank you again, everybody. Thank you, Kurt, for leading that meeting. Dr. Nick, Dr. Jerry, Fred, outstanding information and handled it very well. So thank you very much for that. I'm going to go ahead and see if I can get my technology to work correctly and introduce our next panelist. So, you know, this was really an interesting conversation that we had on the kind of national perspective and regional perspective. And so now I want to bring it back down to our local bold goal, right? Our local area here on the First Coast. So with that, I'd like to, introduce Dr. Pauline Roll, the Interim Director for the Florida Department of Health here in Duval County. Dr. Roll is a board-certified pediatrics and public health physician. She's a native of Miami, graduate of Fisk University and Meharry College, Medical College in Nashville, Tennessee. And she completed her pediatric residency training at the University of Florida Health Science Center in Jacksonville. Dr. Roll completed her Master's of Public Health from the University of Tampa, or South Florida in Tampa. Dr. Roll has been with the health department since 2003. She's been to several of our meetings. I appreciate that. Before assuming her current role, she was a community health physician at West Jacksonville Family Health Center. She was a National Health Services Corps physician who provided comprehensive pediatric care to children birth through age 21 in an area that really lacked quality medical care for children. She also served at the University of Florida faculty member and a clinical preceptor for medical students, nurse practitioner students, and physician assistant students from several colleges and universities here in Florida, as well as Georgia. In 2013, Dr. Roll became the medical director for the Florida Department of Health here in Duval County. And as medical director, Dr. Roll oversees the medical, dental, pharmacy, epidemiology, and behavioral health programs for DOH Duval. She's also the subject matter expert for pediatric and adolescent-related topics such as immunization, sexual health, obesity prevention, and general health and wellness. Secondly is Dr. David Szymanski. And so Dr. Szymanski is the sixth president here at the University of North Florida. He joined UNF back in the summer of 2018, was inaugurated in February of 2019. I appreciate Dr. Szymanski being a part of our meetings. He graciously accepted the invitation to welcome everybody to, I think, his first of the Bold Goal Summits back in 2018 or 19. He's committed to student success. President Szymanski has spearheaded initiatives to ensure that all students have the resources they need to succeed on campus as well as in the community. This includes boosting programs to enhance student wellness, to provide students the opportunities to gain leadership experience and engage in the community. So Dr. Szymanski recognizes the vital role that UNF plays here in the region as a top source of talent and innovation for area businesses and the medical community. He has worked to build partnerships to advance academic excellence at the UNF, ensuring students not only learn on campus, but have abundant and meaningful real-world opportunities outside of the classroom to gain experience in their fields. A new strategic plan for UNF was commissioned by President Szymanski and approved by the Florida Board of Governors back in January of this year. The ambitious plan aims to creatively build on UNF's current success while creating rigorous programs that give UNF students an even greater competitive advantage. So before coming here to UNF, President Szymanski served as the Dean of the Carl H. Libner College of Business at the University of Cincinnati, and during his tenure, enrollment in the Business College grew significantly. Prior to that, he was director for the Center of Retailing Studies at Texas A&M University, where he was a professor of marketing. And finally, a big support of mine and a big resource for our community is our very own Dr. John Montgomery, who's the lead market medical officer for our commercial markets, as well as the health plan medical director for Humana. So he's held several leadership roles at Humana over the past 10 years, including regional medical director for our commercial business segment, national medical director for our commercial outpatient physician team. And for the last 7 years, John has been a market medical officer for Humana's commercial line of business throughout the state of Florida and Georgia. So he's known for his insight, innovative ideas, and passion to improve the health and well-being of our associates and clients. His commitment to our communities is also noteworthy. He serves on the board of directors for all 3 of the Bold Goal initiatives here in Florida, as well as my co-chair here in Jacksonville. So as a medical epidemiologist and former director of public health for the Duval County Department of Health, his expertise is also playing a significant role in Humana's current COVID-19 pandemic efforts across the company. So John is the 2007 past president of the Duval County Medical Society. He served as chair of the Northeast Florida Medical Society's delegation to the Florida Medical Association, and he's a delegate for the American Medical Association, representing the physicians here in the state of Florida. So he received his undergraduate degree from Brown University, his master's of public health from Yale School of Medicine, and his doctorate of medicine degree from Brown University of Medicine. John completed a family medicine residency in the U.S. Navy, where he served as a lieutenant commander and family physician. He was recognized as a leader in the development of evidence-based medicine for Navy medicine. Dr. Montgomery is a board-certified family physician, a certified health insurance executive, a certified physician executive, and a fellow of the American College of Physician Executives. He has been an incredible resource to all of us here in the community. And with that, I'd like to welcome Kurt back, and we will start with our local panel. So thank you, everybody.
Thank you, Paul, and welcome Dr. Roll and Dr. Montgomery and Dr. Szymanski. Thank you for being here with us today. We're going to go ahead and, as I say, we'll just jump in. We're right on time, actually, so we're doing a great job, and I want to keep us there. Dr. Roll, I'd like to ask you the first question and let you kick us off. And that is, as the academic institutions and businesses look to sustain the changes we have had to make in order to reopen, can you highlight examples of practices that should be adopted again in the future?
So thank you for having me. It's great to be a part of this panel today. I think in terms of academic institutions opening up, one of the key things that they've done well, particularly at University of North Florida, I'm very familiar with. My son actually attends school there. One of the things they did was institute distance learning, and they did it at a high level. And so while they had some in-person classes, they were very particular in terms of which classes that would be. So as we expand and contract as it relates to COVID-19, we want to think about those things. How do we move forward with distance learning in the future? We found that we can do well with technology. We've been able to do things that we didn't think we could do before. We've improved on our technology. Telehealth has become very important. Teleworking has become very important. And these things have assisted us in decreasing the burden of cases in the community. Also emphasizing the wearing of masks. As pointed out before, wearing a mask is not easy for everyone. And certainly folks feel like their personal freedoms are being restricted. But we need to look at this as a community effort. This is not just about me as the individual. This is also an effort to protect others in the community. And so I think some of the things that the academic institutions as well as businesses have done well is enforce the need to wear masks, but also that distance learning, teleworking atmosphere and collaboration in that atmosphere has been important toward our success here. And so we need to keep those things in mind as we move forward.
Great. Thank you very much for that. John? We're going to let you take a stab at this question. Should I reread it?
Yes, you should. Yeah, please.
Sorry. As the academic institutions and businesses look to sustain the changes we have had to make in order to reopen, can you highlight examples of practices that should be adopted again in the future?
Yeah, and so first I want to, extend a thank you to you all hosting us and Paul for pulling this off. I think 5 years ago when we started rolling out BOGO, I don't think any of us thought we'd be talking about a pandemic right now. One of the things that's really interesting for me as folks begin this whole idea of reopening and what we do to adopt for the future, I think it's so often important for us to realize that we are constantly learning on the fly, right? This is a flexible environment. Things are constantly changing. And so every single day, there's something that we're learning new as it relates to COVID and as it relates to our practices and what we need to do. I've heard my colleagues on the previous panel talk about the mask, right? And I think it's interesting. We use the 3 W's, right? We use wear your mask, watch your distance, and wash your hands, right? Really easy way to get people to recognize some of those things. So I think it's really important that we adopt some of those very simple practices. Education, you've heard people talk about that, really getting information out. The diversity of employers, and that's really key. What we at Humana have adopted and what we will continue to adopt in the future is just that recognition that it's all about safety, it's all about confidence, and it's all about doing everything we can in developing the trust for our associates and members. And I think that's going to be key. If we continue to do those things and we continue to recognize as we move forward and adopt this is a new norm, Kurt. I think we're all recognizing. And some of the things that we're going to have to adopt to, we don't even know what they're going to become. But we know having compassion and recognizing those first responders. I mean, Pauline and others in this community know we owe an incredible debt of gratitude, not only here locally, but around the country to our first responders. So we're always going to be looking at ways to recognize, adopt, and engage our compassion and appreciation for the work that we do and for taking care of our members, because we're constantly learning social isolation, food insecurities, all those social context things that we're seeing in the midst of the pandemic. When we're always talking about the medical issues, are also concerning to us as well, and just helping our associates and members manage through this and then doing everything we can as we adopt to a new norm.
Thank you, sir. President Szymanski, do you have examples of practices from your standpoint that we should adopt in the future?
I do, Kurt. Thank you. It's good being here. Thanks to Paul, thanks to Humana, and thanks for the Bold Goal Initiative. I think it's wonderful. I think if we look at moving forward, we talk about as the institution about how can we be better, stronger through this pandemic and really continue to move forward. And if I look at the question that you gave, there's individual behaviors that I think make a lot of sense. But then there's really the kind of the culture, the way of thinking, the way of approaching issues that really is the sustainable part of this. Dr. Roll talked about really flexibility and being nimble with respect to educational options. And we find out that students learn better under certain circumstances than others, and it varies by students. So understanding that we have to have really kind of precision learning and precision instruction and what really works well. And our faculty now is, has talents that, everybody has the same talent now, which you can teach remotely. And so what a phenomenal thing to take forward. But I think there's a couple other fundamental things that we will take forward as an institution that'll make us a better, stronger institution. One is that we realize that getting through something like a pandemic is a shared responsibility. It's not looking at one side or the other side. It's really all of us working together, realizing that we have to engage in the proper behaviors, whether it's wearing a mask, social distancing, washing our hands, just being responsible in terms of how we act and how we perceive things. That shared responsibility is getting us through this. When we look at our students, and I drive around campus, and I'm in campus right now, you look out the window, everybody's wearing a mask. We thought that would be a difficult thing to get people to wear masks. And I'm really so proud of our students and our staff and our faculty, because that safety issue of wearing a mask is really front and center. So we have people who understand shared responsibility around safety. We also understand how to be flexible and nimble. We also understand how to be prepared. And lastly, a term I used a few moments ago, is really about team. And how do we come together as a team? How do we come together as a staff? How do we come together as a faculty? How do we come together as students? How do we come together as a community? Because without Dr. Roll and the Department of Health, we wouldn't be where we are today, which is we're reasonably safe as far as the institution is concerned. But it is that shared responsibility. It is that sense of team. It's working with the community that really are the things that we're going to take, and take with us moving forward. That's going to make us a better institution but also make us a better community.
Thank you for that. John and Pauline, any response or follow-up at all before we move on to the next question?
I was just going to say, if it would, it's consistent with what we've been talking about with Bold Goal, right? Bringing together collaborative individuals, collective impact, all of us working together to address these issues. And I think President Szymanski summed it all up. And that's what we've been doing as part of our Bold Goal initiative with the various community stakeholders, and what this initiative is and this issue is teaching us as well.
Thank you. I do want to take a moment just to again remind the audience that we are taking questions, so please submit those with the Q&A button at the bottom. We will have time at the end, and so you can start that and put those forth anytime. Well, I'm going to move on to the second question then, if that's all right. I'm going to direct this to Dr. Szymanski. What will your organization do differently the next time we face a pandemic? And your response can focus on reopening specifically or on a bigger picture if you prefer.
Yeah, I think probably the difference is that we'll have a protocol in place. We'll have a team in place. When we think about crisis management, and we prepare for crisis management all the time, we haven't really prepared for a pandemic. And so the thing that's different is that we'll at least have a little bit of a playbook that we can look to, that we can sit there and say, what do we need to adapt to a particular situation? But we've identified people, we've identified roles for people. Kurt and his team has played a tremendous role in terms of helping us through the crisis. So I think the things that we'll do different is that we'll be further along in terms of the knowledge curve and the experience curve, so that we now start looking at the really small increments of what do we need to do, fine tune to prepare for something very specific, as we also prepare for flu season right now. We're a little bit better prepared for flu season than we were prior to the pandemic. And so those kinds of things, I don't think there are major things that we'd be better at, but I think the fact that we've been through this, and we've been through the exercise, we're continuing to go through this, back to what Fred was talking about in terms of diligence, not letting our guard down. These are things that are really important to us to move forward. So I think we have the people, we have the acumen, we're better prepared than we were before. So we'll fine tune it, to the specific situation, Kurt.
Great, thank you. Dr. Montgomery, same question. I'll read it again. What will your organization do differently the next time we face a pandemic?
Kurt, I almost want to take the same words that the president said. I don't know how much we would significantly do differently. As Paul commented earlier, I'm a former public health officer, and I can't tell you how impressed I've been with my organization's response to this pandemic. From the very beginning, our CEO has brought together a multidisciplinary team across our enterprise to really focus on this, to be very focused on our members, very focused on our physicians and providers, and then very focused with our Humana Foundation on our community. So collaboratively, we as an organization have been very proactive. We fortunately have, resources where we've been able to deploy very quickly to address some of these issues. And so I think just more, we're going to take that slow approach in terms of re-emerging and getting back into the workforce. But I think we've done a lot. And I think it's that nimbleness and flexibility of learning that we recognize. I think that we would probably say we want to just put more resources out there to really be able to recognize the unique needs of our members. And then how do we better proactively anticipate what members are going to need? We focus in our Medicare population. We know the needs of elderly individuals. And so I think focusing on all of those and putting community-based structures in place that could help us weather the storm per se. But as an organization, and over the 30 years that I've been involved in public health and infectious diseases, I can't say that our response was anything other than the best, in my opinion, in terms of our doing things and what we could do different. So I'm very pleased with what we've done. I don't know if I want to just point to one thing that we could probably do differently.
Okay, great. No, I appreciate that. Dr. Roll, what could the Florida Department of Health, Duval County, do differently next time, if anything?
Well, I think as stated, we now have a playbook. This was new to all of us. So we're working from scratch, trying to figure it out. And so one of the things that we gained from this is we had a better understanding of what we're capable of, but we also have a better understanding of what our community is capable of. We understand better who our partners are, who is readily available, what their resources are. And so that better prepares us for the future. And so I think at this juncture, there isn't necessarily anything we would do differently. It's more so we have a better understanding of what we have here in our community and what we can do. and how successful we can be. We've also done a fabulous job of forming teams in our community, identifying our strengths and weaknesses throughout this COVID response. That has allowed us to make the appropriate adjustments to better meet the needs of the community. We've heard from the community as the Florida Department of Health in Duval. We hear from the community regularly, asking us very wonderful questions that help improve the services that we offer. And so we've been able to make the adjustments as we've gone along to be more accessible to our community, to make sure their needs are addressed, because at the end of the day, you can get through this pandemic and not have adequately addressed the needs of the community. And so at the end of the day, we want to be better on the other side of this. And I think we are because of this experience. So I would say at this point, we have a great playbook. We have the partners in place. Everyone understands their role a bit better. And I think even in this, people understand the Department of Health's role a bit better in terms of addressing the needs of the community. And so COVID-19 has afforded us a world of opportunities to shore up any potential issues that we've had in the community, but to also demonstrate our strengths.
Well, and I just want to thank you.
I would say nothing.
Yeah, I want to thank you personally, because I've worked with a number of yourself and your colleagues there, and we'd have been in a much more difficult shape without your assistance. So we appreciate everything you're doing.
You're welcome.
Dr. Szymanski or Dr. Montgomery, anything else to add on this question?
I don't think so, Kirk. You know, I guess I'd like to publicly thank our team, because if you think about getting through this, I think I'm not any different than Dr. Montgomery and Dr. Roll. I think we've had people who've stepped up. When we look at how people have stepped up in a crisis situation and something that's totally foreign to all of us in terms of how to cope with it, we really are surrounded by phenomenal people who make a difference and people who care. And I don't think we can thank people enough, because it's not any one individual. It really is a collective community that's putting this together and helping us move forward.
Thank you for that. Appreciate it. I'm going to move on to the next question then. And this one will go to, John, this one will go to you. What does the general public misunderstand with respect to reopening?
I think that the unique things that most of them misunderstand is just that the uniqueness of employer groups, the uniquenesses of businesses, the unique challenges of schools, the unique challenges of an infectious disease, right? And so when we recognize that 40% of the people with this infection are asymptomatic, we don't even know who's out there being infected. And so just understanding that we want to take it slow. And that's one of those things, slow and deliberate process. I think folks fail to recognize that need. I oftentimes say, as an infectious disease guy, if you got coronary artery disease or had a heart attack, I wouldn't be impacted by that. But if you have flu or corona and you're sitting within 6 feet of me, I'm going to be impacted. So it's the recognition of what we're talking about when we talk about an infectious disease, and that in different environments, some folks will have to go back to work. We have individuals in our organization that need to be in the office. And so that recognition is that there are going to be protocols in place. There's going to be screening, testing, questionnaires, and all those sorts of things. So to recognize that as we move back into getting back to operating our businesses as we can, that people are going to have to go through a process of getting screened when they walk in and all those sorts of things. And understanding that and being patient, taking time, because there's so much that we understand as it relates to testing, vaccine development, et cetera. And so reopening is, as you heard in the first panel, it's complex, right? It involves a lot of variables that we have to consider. And our public health officials like Pauline and others are helping us make those sorts of decisions. Leaders in my company and leaders at your organization at the university are making those same kind of decisions. There are going to be uniqueness. Male folks have to get back, right? Frontline people have to be back. And we have to ensure the safety for those individuals before we bring them back into the workforce, and maintain social distancing or workforce distancing within those workforces. So folks just can't come back as business as usual. We're going to have to implement precautions and opportunities for people to be protected when they're in that workforce. So that's the understanding I think people need to understand with reopening. There's a lot of challenges, and we're going to work through them, but it's going to take time.
Okay, thank you. Pauline, same question. What does the general public misunderstand with respect to reopening?
So I would say the misunderstanding is that, so what people need to understand is COVID didn't just go away because businesses are reopening and restaurants are opening and you can go to church. I can tell you my team speaks just about daily with someone in the community who doesn't believe this is real. They can't be positive for COVID. The numbers are inflated, the deaths are inflated. And so there are still people in our community and across the nation and the world who believe that this is not as bad as we've said it is. And they certainly think that even more as we start to open up. And so I try to ask people to use caution and wisdom. As you begin to go out and resume some of your normal activities, keep in mind that just because you don't see it doesn't mean it's not there. Again, as Dr. Montgomery mentioned, we have a lot of folks who have been positive who are asymptomatic. We're still not sure how infectious they are and at what rate they can transmit the illness, but we do know that they can transmit it. And so what I think folks become a little bit lackadaisical as we move forward and through our phases, and they start to think, oh, life is all good and it's as it should be. But I ask folks to use caution as we move forward and not to assume that the virus is not out there just because you personally don't know anyone who's been affected or because you can now go to your favorite restaurant and sit in and eat a meal.
That's great. Thank you. Dr. Szymanski, what does the public misunderstand with respect to reopening?
So I'll just add something kind of simple. It's really kind of the semantics of it. It's really not a reopening. So a lot of us have been open all the time, but it's really a new opening. And so it's not going back to where we were in March. It's not going back to where we were in February or where we were in the fall. It is really a new opening for people. So as we emerge, there'll be practices that no longer exist. There'll be practices that have been modified, and there'll be new practices that we'll see. So I think the expectation really can't be about a reopening like the doors open and everything's the same. It really is a new world. It is going to be a new day, and it's going to be new behaviors and new ways of interacting. But it really is a new opening, a reimagining of what businesses and really in academia is about too.
Great. John or Pauline, anything to add? Okay, I appreciate this. I'm going to throw this last question that I have out to whoever wants to take the first stab at it. It's a little loaded, I suspect, but can you discuss the leadership challenge of balancing human safety, finances, and any other factors you wish to discuss during a crisis such as this? Any takers? Dr. Montgomery looked away from the camera for the first time.
I did because, and you know why I looked away, right? Because I see the president and I see the interim director of the health department. I mean, I guess I could have deferred to them too.
Oh, funny.
So does that mean we have budget authority? Is that what you're saying? So I'll take a quick stab at it. Anytime we're dealing with things, it's really one of sort of satisfying. How do we do a good job at essentially trying to maximize each one of these different dimensions? But there are financial constraints because even coping with this is very expensive. At an institutional level, there are also expenses. But we also want to make sure people are safe. So it's a constant, juggle. The algorithm's not really simple. You sort of need a Cray computer to figure this thing out at different points in time. But you keep looking at it and you keep adjusting, and it's really kind of an iterative process. What's next? What do we need to do? And so it's cognitively taxing, but at the same time, there's a cognitive challenge around to make sure that you're doing, at the end of the day, always the right thing. And I think that's your guiding principle. And I think it's the guiding principle of all the people around these calls of how do we make sure we're doing the right thing in terms of safety, the institution, the community, you name it. We're always trying to do the right thing. So did I dance around that enough, Kurt?
No, you did a good job. And it also made me think about something we probably all experienced. And, we hear as a university from parents concerned about their children. And within 5 minutes, I can check my email and find that one parent is complaining that we are being far too restrictive and asking us why and quoting CDC guidelines. And then the next parent is saying just the opposite. You're not keeping my child safe enough. Don't you know that X, Y, and Z? And that's kind of to some extent also what this question goes to is how do you balance an impossible situation? And fortunately, Dr. Roll is going to tell us how to do that.
So unfortunately, you probably lose more days than you win. Everyone thinks they know what you should do. And so I think one of the challenges of leadership is getting people to understand your position and what it entails and what you're challenged with doing. Like for the Florida Department of Health, we have state statutes that govern a lot of what we do. and there are rules and laws and policies and procedures. And so a lot of that drives how we handle things. And so I think as a leader, I've had to step up my game in terms of educating people, being patient, and being able to have those hard conversations with folks, because people are genuinely concerned. You have a lot of concerned citizens in the community, and while we may not always agree with their position, I think in some respects, they're still deserving of an answer. And so in being a leader, I think it's important to be transparent, to be accurate, and to be first on the scene in terms of dealing with the issues. And so that's been a huge challenge for us here, because there is always someone who thinks they're the expert or thinks they know better. And certainly we appreciate all of our community partners giving input to the process. But at the end of the day, a lot of what we do is driven by policy, procedure, and statute. The other thing in terms of financial issues, certainly this COVID response has required large sums of money in terms of driving, but I can say the federal government, the state government, and even city government stepped up to ensure that we, as well as others, had what they needed to be successful in this venture. And so again, getting the community to understand what's available and how we can help, I think has been a huge challenge, because in some respects, we've been deemed the enemy on several occasions, or we've been misunderstood, but part of leadership is being misunderstood. And really all you can do is try to educate and move forward and protect people in the best way that you can.
Thank you. Dr. Montgomery or Dr. Szymanski, anything to add?
No, and so one of the things that's really important, and you all know this, employers are definitely having to balance the short-term and, risk and incentives. And one of the things that we've done as an organization is recognizing the challenges that folks are facing, even our members. So early on, we did a lot in terms of waiving co-pays and cost sharing for tests, and waiving cost sharing for telehealth, and all the things that we can do relative to primary care visits. We did a lot to decrease friction points for the doctors and hospital systems in terms of helping them get through this financial crisis. We decreased utilization management, decreased prior auth, and all those sorts of things that kind of recognize that, we're trying to do all we can to help folks weather this financial storm. And then we've given out millions of masks to children and to others to really just try to be a part of this community and shaping the needs of that community. So as an employer, we recognize we're trying to build trust and confidence. We're, to Pauline's point, being very open and transparent and communicating with folks and recognizing there are a lot of needs. And as we see those needs constantly emerging, as we can, as an employer, we're going to continue to expand what we do to help individuals address those needs. So always balancing what we have to do from a stakeholder perspective, but recognizing we got to do all we can to take care of our members and associates.
Okay. Dr. Szymanski, anything to add?
No, I think I'm good, Kurt.
Okay, great. Let's go ahead and kick right to, I've got 2 questions so far. And again, please feel free, audience, of sending more in. We do have several minutes still, well, at least 4 that we can work on these. First one, would you recommend having a certified and insured company clean and disinfect these institutions for additional safety? Not sure who might want to jump in on that one. Anybody have a thought on that question?
So it's not, from the health department standpoint, it's not necessarily to have a certified company to come in clean. There are specific guidelines provided by the CDC as it relates to cleaning. Now, there are some businesses that may choose to do that as an added measure of protection, or because they're unsure of what cleaning products they should use, but certainly it's not a necessity to do so. And again, the Centers for Disease Control offers guidance in terms of disinfectants and cleaning.
Thank you. Anything to add? Dr. Szymanski or Dr. Montgomery to that?
I think I'm consistent with Dr. Roll. We have our people who are doing a phenomenal job cleaning the classrooms and using the proper procedures and proper products and so on. So I think it's, it all depends on your organization, but we have people who are extremely competent at doing this.
Okay, great. Thank you for that. I'm going to go ahead and skip to the next question. How do you help our community make sure they don't have quarantine fatigue and start to let their guard down because they're tired of social distancing and wearing masks?
Well, I guess that one's on me, since we tend to be the ones that quarantine people. It's the reality. People are tired. They don't want to stay home, and that's a difficult thing. Certainly, we're there to be a listening ear. Folks can call us, and if they just need to talk to somebody, 904-253-1850. We answer calls 24/7. And certainly there are people we reach out to in the community as we do our contact tracing, and they really just want someone to talk to them. And we're available to do that, or connect them with resources in the community should they have a need, like if they have food insecurity or medical issues and things of that nature. And so we're in this for the long haul. There is not a good way of decreasing the fatigue except for engaging in activities, finding hobbies and things of that nature. But other than that, this is for the safety of the community. And so I think that's first and foremost that people have to keep in mind, that this is not about you as just about you as an individual, but it is also to keep the community safe and your loved ones and friends in particular.
Our other panelists, feel free to weigh in.
Kurt, I think there's two things. One is that I think it's important to say thank you to people for their changed behavior. So I know on campus we tend to do this, and my wife and I were out at the library not too long ago handing out vouchers to students, just thanking them for wearing their masks as they came in and out of the library. And so reinforcing that behavior I think is important. The other part, and maybe people can learn from academic institutions, we have people who are working really hard to think about alternative ways to entertain, and alternative ways to entertain either remotely or through distancing. So we have the movie theater that we have in the parking lot in the back, and so we have a drive-in like other people are doing. But we also have online games that we're doing with respect to, you name it, sort of the Wheel of Fortunes, the Jeopardies, and so on, and trying to, again, sort of create that excitement, that sense of community. And so how can you do this with your workforce? How can you do it within your company? So it's not enough just having a Zoom meeting, we brought the team together, but how can you make things fun for them? We're doing virtual graduations, heaven forbid. We'd love to do these things in person, and it's important to our students, but we're trying to make the best out of it, out of the situation, by creating new ways of doing things and new activities. And I would encourage and challenge companies to do the same thing. How can you make it fun for your people who are isolated? Sometimes that human contact and that ability to just smile, is really important. So use my wife. My wife reads great. She's a first grade teacher. So she reads books to our students when we do Zooms. And you want to see a bunch of students and a bunch of adults lean in for, a first grade story that says, I have a special talent, or I can do this. Just try to think about different things to make people, feel good about themselves and put a smile on their face and give people a high five.
Thank you for that. And Dr. Montgomery, we're going to give you the last word. And I do want to tell the audience that we have a couple additional questions. We will send out responses to those after this is over, just because we won't have the time. So please, John, I'm going to give you the last word. Did we lose him?
I think he dropped off. I think we lost him.
He really is scared of me, isn't he? All right. Well, with that, then, I am going to go ahead and thank Dr. Montgomery, who is already gone. He's an important guy. He had to leave for something else, clearly. Dr. Szymanski, Dr. Roll, thank you for being with us. We appreciate it, and come back again in the future. Paul, it's all yours.
Oh, great. Thank you, Kurt. And again, Dr. Montgomery, who had to leave, it looks like, Dr. Roll and Dr. Szymanski, thank you very much for being a part of this. And thank you again, Jerry, Fred, and Dr. Nick, for joining us. If we were here in person, I'm sure there would be a roaring round of applause for all of you and the great information. And so, Dr. Roll talked a little bit about it, and everybody kind of touched on this. This is new, right? This was new. The pandemic was new. The issues surrounding this pandemic were new. But the issues in the community, the barriers, the health challenges that people face, that was not new. And the pandemic really shined a light on those issues in the community, the challenges that people are facing. And so, not only do we have a shared responsibility, as been mentioned before, to help, us all stay healthy and safe through this pandemic, but we have a shared responsibility to help the community, right? And that's what this bold goal was about, was a collective impact model about making a difference in the community. We all don't have to work on exactly the same things, but if we're pointing in the same direction and we're really looking to overcome health challenges and barriers in the community, we have to be able to do that. And so I thank everybody for being a part of this meeting this morning, for calling in, for dialing in. I'm going to make sure that, we get this out to everybody. Those questions we'll answer as best we can. But Dr. Roll, you mentioned it during one of your answers. let's come out of this better on the other side. And so we have the challenge of the pandemic. We're working our way through it. And now we have an opportunity to really make a difference in our communities and come out better than we were and eliminate those health barriers. So thank you very much, everybody, for joining us. Thank you again to our panelists. Thank you to Kurt and Justin for running this meeting and helping me overcome my technology challenges. Dr. Szymanski and the team at UNF, thank you for hosting our very first virtual summit. And we are going to have a second virtual summit. Right now, it's October 13th. I'm still finalizing the panelists, but it'll be hosted by our friends over at Jacksonville University. So again, thank you, everybody. I hope you have a wonderful rest of your week. And please reach out if there's anything I can do or you have ideas, questions, or ways that we can really make a difference. So thank you, everybody. Have a great day.